Well, you know, you hear about people who have to live with pain every day. I have so much more understanding now for my grandmother who had rheumatoid arthritis and what she was dealing with on a daily basis than I did when I was young. And doctors are finally starting to come around to this idea of chronic pain and how to deal with it. So we're so glad to have Doctor of Chiropractic, Dr. Jason Mazzarelli here to talk about this. It's about time people spent some research dollars on figuring out how people can manage pain.
It definitely is. Stanford recently did some functional MRI tests, and what a functional MRI does is it measures brain activity. So they actually found that people, for example, with fibromyalgia, first off, fibromyalgia was considered something that could have been fictitious. People weren't sure about it.
They thought maybe people were making it up.
Exactly.
They couldn't find anything physically wrong, right?
Exactly. Recent research, they actually put needles that monitored biochemicals in the trigger points of muscles, and they found that there's an inflammatory reaction around these trigger points. And if the trigger points are actually treated appropriately, the inflammatory reaction moves away. Now, it really comes down to diagnosis because you have something called a primary trigger point and a secondary trigger point. A secondary trigger point develops if you get a muscle that's injured and it doesn't get treated, it starts to affect other muscles. That becomes secondary. And they show that if you treat those secondary trigger points, the inflammatory markers do not remove. They stay.
Because the initial injury remains.
So it doesn't matter how much of treatment you get. If it's not appropriate, it's not going to help you. And then what else happened is they did an fMRI to study fibromyalgia, and they found that there's a dysfunction of the opioid receptors in the brain. So people that were taking opiates for fibromyalgia was actually increasing the sensitivity of those receptors and causing more pain. And they just found that out.
So again, a reason why you don't want to be stuffing yourself full of drugs if there are other ways. So how do you understand a person's pain? How do you approach that?
It has to come from the diagnosis and the training in chronic pain. I'll give you an example of a client I had. He believed he had a disc injury. He went to the orthopedic surgeon, the neurologist, the physiatrist. All of them looked at the symptoms. They thought he had a disc. They sent him out for an MRI. The MRI didn't show anything. And then they thought he was starting to sort of fake it or be fictitious about his incidents. So he went to Europe and got treatment for 2 months with experimental decompression therapy. No resolution, also numbness in his legs. He came to me, and what I found, it wasn't a disc lesion, it was an SI lesion. So basically, it was an SI joint referring pain into his leg.
So he was feeling it over here, but the problem was over here.
Yep. After 8 visits, he said 80% improvement, no numbness in his leg. So it really comes down to the diagnosis. And if you look at the chronic pain training in Canada right now, the best bet is to look at the Canadian Academy of Pain Management. They have close to about 300 members. The thing is, there's only 28 members that have credentials that actually took tests. Yes. So it's very hard to get the appropriate diagnosis at times.
And it must feel, when people are being diagnosed by you, they must feel like finally someone gets it. It must be such a huge relief to know that you actually understand the pain that they're feeling.
Yeah, they're pretty thankful, and it's kind of nice to see. And another study, just with the medication issue, another study came out using fMRI, and it showed that if you have prolonged opiate usage, which they considered prolonged usage over 30 days, it causes a loss in gray matter.
I.e. the brain.
Yes, which means that you can have mood disorders, you can have short-term memory loss, you can have movement disorders. So it all plays in this. And if you look at the people, think about in the 1980s or the 1990s when people were getting back surgeries before they knew that they didn't need surgeries for certain things. And then this causes a dysfunction of spinal levels, and it keeps going up and up and up. And they've been using opiates for 20 or 30 years now. So, you know, it's quite amazing.
You've brought some pictures with you, so let's look at these, and we'll get some insight into what's going on here. What's this?
This is the dorsal root ganglion. So basically it's...
Where in the body is that?
That's your spinal column.
Oh, okay.
And that's the nerves going into your spinal column. So you have nerves in the periphery. They go into your spinal column, and then they go up to your brain, and it tells your brain signals of what's going on. So basically, this is a cell body. It has a bunch of cell bodies that take in sensory information. Research has shown that chiropractic adjustment will actually reduce the activation of this, which reduces pain signals to your brain.
Brilliant.
This next one here is a picture where the amygdala is in your brain. The amygdala deals with emotional experiences related to pain.
Is it the yellow part?
It's where the arrow was.
Okay. I think there you go. Yeah.
Right there where the little arrow is on the left. So basically what that's showing is that they just did an fMRI study that showed that acupuncture can actually reduce the activation of this and thus reduce pain.
Oh my goodness, thank goodness. So these are some of the treatment options, the chiropractic adjustments, acupuncture. What else can you use to treat people's pain?
Soft tissue massage. This could be trigger point therapy. It could be more advanced therapies like ART, or it could be the generalized light touch therapies that just activate mechanoreceptors, and basically mechanoreceptors inhibit nociceptive signals to the brain, which are pain signals to the brain. We also do nerve mobilization. At times, the nerves can sort of get tight because they have to move through tissue or around bone, and this can actually cause some of the numbness into your hands or into your legs. So by putting the joints in specific positions and gently stretching it, you can actually reduce the tension in the nerves. So we do nerve mobilization as well.
And then these treatments have a much longer lasting effect, right,
Yes.
than just drugs.
Yes, chronic pain is either nociceptive or neuropathic. Nociceptive means there's a tissue damage. So if you don't correct that tissue damage, it doesn't matter how many drugs you take, that tissue damage is going to continually be there, continually aggravate the nerves and make them super sensitive, and then you get continued pain. So our goal is to find what the cause of the problem is, and then prevent that cause from continuing.
Why don't they all deal with it that way?
I wish they did.
I know. Well, then, there'd be more of you around, which would be wonderful, right? You
Yep.
must have people coming to you from all over.
Yeah, I've had people from British Columbia. I've had them from the Virgin Islands, the U.S., so we've had quite an extent of regions.
But you're based out of?
Finch and Young in Toronto.
Perfect. So close by for us,
Very
thank
close.
goodness.
Yes.
So the types of pain you can treat: fibromyalgia, disc pain, what else?
Basically, any kind of musculoskeletal pain. The only thing we really couldn't treat is visceral pain.
Which is?
Heart issues,
Okay.
kidney issues, lung issues, things like that. But any kind of musculoskeletal pain we can treat.
So it's an organ thing, not your field,
No.
but anything else.
Yes.
That is such good news. And I love the idea of not having to take more drugs, because then the drugs, in time, cause other side effects.
I actually took a course through the University of Pennsylvania School of Medicine, and it was kind of funny because they had a pharmacologist on there, and they talked about all the drugs they used to prescribe, and then all the side effects. And it was actually a circle that had maybe about this drug, like about 20 drugs that said this drug is used for this side effect, and then you have to use this drug for this side effect. And I'm not saying that pharmacological therapy is bad, but it has to be used in moderation, and it has to be used when it's appropriate.
Well, if you want more information, drmazzarella.com. Thank you so much.
Thank you for
When
having
we
me.
come back, some Valentine's Day yummies with Marianne Amadeo. Good information.